So it's very personal to me. My sister was diagnosed with ovarian cancer in around 2007. And we live in New York City, the capital of the world, and just thought, okay, she's got ovarian cancer diagnosis. We're going to find resources. We're going to find events and a community of people who have ovarian cancer. And it was really challenging. And we were just shocked by that. So it sounds simple now to talk about it, but it was a lot. But we basically made the resources she was looking for. That is the core root to our foundation. Louisa did lose her battle years later, about almost 5 years later, and she helped us get the foundation started. She helped us start what we call the Teal Walk. Our ovarian cancer walk has had satellite walks in different cities, but one of the main things that we wanted to do was make a lot of noise and tell people about this disease. So um, the name of our foundation is Tell Every Amazing Lady, and it is the symbol of teal. When we heard that the color teal, which I'm wearing today, is the color for ovarian cancer, we came up with an acronym, and Tell Every Amazing Lady just stuck. So, um, being impacted with a family member having this disease, and not everybody's going to start a foundation, but we sort of took a negative and made it a positive, and we wanted to provide resources for other families like us. Yeah, well, ovarian cancer is one of those things where most women think when they go for their annual exam, if you can even get them there for the annual exam, that their ovaries were looked at and everything below the belt has been reviewed and you've got the all clear from a doctor. And that's very misleading because there is no screening test for ovarian cancer. The pap test does not test for ovarian cancer. And I'm going to say that again, there is no screening test for ovarian cancer. There's nothing that's 100% accurate. So this is a disease that's usually caught at a late stage. It's quite often missed and it's misdiagnosed quite a bit. So we, have tools that are at least signs and symptoms and risk factors that we can cover now. And it's definitely something that my foundation advocates for and promotes. But even with all that information, it's still really difficult to detect. So knowing a family history is pretty important. For instance, my family history has ovarian cancer in it, but we also had colon cancer and esophageal cancer, and those pose to be a risk. So we decided to get genetic testing done and learn that my family does, in fact, have a gene. And that's not always the case, but it is something that's really important as a tool that people can have because there is no screening test. So the risk factors, could be a family history of breast cancer, colon cancer, endometrial cancer is also important, and even uterine cancer. If any of those cancers are in someone's family, you really should consider genetic testing if you're worried about ovarian cancer in particular, and or any of those cancers really. But because there's no screening test, the signs and symptoms are also really important. um, the importance of ovarian cancer is that those signs and symptoms are really vague too. So it could be like pelvic pain or abdominal pain or bloating. Like what woman doesn't maybe get some of these symptoms once a month? Back pain is also included as well. And I'll use an example where my sister had back pain as one of her symptoms, and she also had abdominal and pelvic pain, but she had an old back injury. She had other things like endometriosis, and there sort of seemed like there was a reason for these symptoms. And even the doctors don't have the tools to detect it. So they were sort of blown off and pushed out to the side. But she was seeing doctors and saying, hey, this thing is bothering me. So the point is getting back to the family history. We knew that there was some family history of other cancers, but there was no ovarian cancer in our family. So it wasn't even on our radar. And now that we know about genetic testing, and later after her diagnosis got genetic testing done, we realized how important that is to understand that and talk to your family about, what diseases besides cancer, even in someone's family. There's even a family who has diabetes. Family members did, some of them did, some of them didn't. It's not for everybody. It's a very personal choice. And the way that I had my genetic testing done is when my sister was diagnosed very soon before or right when she was starting to get her treatment. This was around the time where immunotherapy was sort of cutting edge and brand new. and her doctors felt if they knew about her genes and had other family members, if we know that if there's a Lynch syndrome or a BRCA positive in the family, they would know how to treat her. So all we heard was this could help her with her treatment, and myself and other family members were like, okay, what do we need to do? This can help her. Take my blood or swab or whatever we need to do, and it has come a long way where when had genetic testing done, I didn't really understand it completely, and this was before we started our foundation, and I got a positive result and was really shocked by it. I didn't think this had anything to do with me. We were doing this to help my sister with her treatment, and so when we learned that myself and other family members have Lynch syndrome, we were like, "What does this even mean? What do we do now?" So we're just like everybody else, learning and walking through this, but I will emphasize that genetic testing is not for everyone. And what we found and still to this day is important is to sit down with the genetic counselor first and really talk about it and truly understand if you are positive or negative, what that impact might be and how that might feel to get those answers. And so there is a lot more guidance and help. And we are also a resource who can help with that if anybody is interested. But it's a personal decision and choice to do that. When I got this test done, I was still in my 20s. I was sort of newly married and was being told, a week after getting results, you need to have a full hysterectomy. You need to do all these crazy things that I was like in shock over and just wait a second, what are we even talking about here? So I think it's important to recognize that. And I didn't realize that that's what I was getting myself into. But like I said, I don't want to create fear for anybody because it's really important to know that. And now I feel all of that knowledge and information was power for me. And even though, a genetic counselor was advising me to do these things, it wasn't that I had to do them immediately or that day or overnight. It was that, hey, wait a second, we just learned that you do have a high risk to cancer. I have a gene. There is no test for ovarian cancer, so there's not a lot we can do about it. And I did begin to feel empowered with the information. And so the information for me, particularly having Lynch syndrome, which maybe not a lot of people know what Lynch syndrome is, but it is an increased risk for colon cancer, ovarian cancer, uterine cancer, and many others, but those are the like higher three. And so it makes sense. My sister had Lynch syndrome, she had ovarian cancer, and I've got the same syndrome that she does with genetics. So there's kind of alarm bells going off. What am I going to do about this? So I waited a long period of time, many years, even more than a decade, for me to actually have a full hysterectomy. And I only did it when I was ready and it was the right time for me. Um, and it's a big decision. Some people may choose to never have a hysterectomy if they're being told because of their genes, and there's surveillance that can be done. I chose surveillance for a long time, and then I felt more comfortable having everything removed. There's other things that are advised for me. Right when I was, diagnosed with Lynch syndrome, I was told never to miss a colonoscopy, and it's interesting that that was told to me. I had already been having colonoscopies. I had, some symptoms on its own, and I actually was having enough colonoscopies that I've had many polyps removed, and one of them was actually really large and had to be surgically removed in a hospital. So I'm convinced that a colonoscopy saved my life, and I didn't even know it. And now I can associate it and put it together with genetic testing. And this is how important this information is because knowledge is power. And I won't miss a colonoscopy. And those things do save you and protect you with information. The other thing that I've done is I have a urologist who, that's looking for bladder cancer and checking out, those types of that organ and those types of scenarios where, cancer can, with Lynch syndrome, can hit different organs. And it's just important to have these follow-up exams. It might sound really complicated, but if I just have an annual screening with these couple of specialists, a gastroenterologist, a urologist, and a gynecologist or OBGYN, I was seeing a gynecologist, oncologist because of my risk. Those three doctors are really important for me not to skip those exams. It's just really important that genetic testing is something that is advised for those families at risk, and it can be really powerful as a tool for surveillance and for, preventative, to prevent these cancers. Just going back to knowledge is power when, any advice about genetic testing, I would say don't be afraid and really educate yourself and try to understand your own family history. Some people don't know their family history. Maybe that's impossible to have a family history, for many reasons, adoption and people may not be around to talk to anymore. So, this is a link to your health and something that you can take seriously and make it important and to not miss those doctor's appointments. But the thing with ovarian cancer is that even um, someone who is educated and knows the signs and symptoms and knows the risk factors and goes to the doctor for this particular disease, it can still be missed. So, genetic testing is one of those tests that actually can shed some light on a family who might be at an increased risk and then empower them with some tools that might help protect not just you, but think about maybe sisters, nieces, grandchildren, daughters. We looked at this as something that would help the whole family understand that there is a family risk and a link to this disease. I'd love to go back to the signs and symptoms and spend a moment on that, where, ovarian cancer oftentimes has vague symptoms. So, back pain. Someone might have a previous back injury or not really think that that could be a symptom of a disease or something. There's bloating. Every woman usually has bloating, maybe after you eat a plate of nachos or it's once a month. But bloating is a pretty common symptom that most women get, from time to time. Abdominal pain, pelvic pain. Sometimes changes in bowel habits. There could be a feeling of fullness. Maybe you just can't finish a plate of food the way you used to, and you find yourself not being able to, finish a meal or losing weight for no reason or gaining weight for no reason. You're not on a special diet and, something is fluctuating because these symptoms are kind of vague and could mean something else or you might have a reason for it. It's really important to just pay close attention to it, and if they last for more than 2 weeks and they're not associated with something else, it's still important to question your doctor and say, hey, can you just prove to me that I don't have ovarian cancer? And that in a nutshell is tough because there's no screening test, but it's still something that should be on your radar. And using this video as an opportunity to just learn a little bit more about ovarian cancer. The takeaways are that the pap smear does not test for ovarian cancer. Your annual screening test is not looking for ovarian cancer. There is no screening test, but there are signs and symptoms. And then some other risk factors are also a family history of breast cancer, which is also associated with ovarian cancer, colon cancer, of course, ovarian cancer, sometimes endometrial cancer. There also could be someone who's never been pregnant. It actually could increase your risk. But there's some good news. Reducing your risk could be someone who might have been on birth control for more than 5 years. That actually lowers the risk, which is nice. There's a lot of studies showing that that's about a 50 percentile reduced rate. And then there are some things that you could ask your doctor for. So, for instance, before I had my hysterectomy, I would ask for a CA125 test, which is a blood test. It is not a perfect test to check for ovarian cancer, but it does sort of show some red flags in some individuals, but it can completely miss it in others. But it's something where maybe when you're having your cholesterol checked, you might just say, hey, doc, can you put on a CA125 test on my blood test as well? And usually that's very easy to do. I was also having a transvaginal ultrasound, which is also part of our guidance. That's something that you can do or request from your OBGYN. And there's also a vaginal pelvic rectal exam that your OBGYN can also do. So those three tests are something that can also maybe catch this a little bit sooner or catch a red flag, even though there is no test. So those are some of the tools that will be really helpful for this disease.